It's been a long wait for the Bharat Biotech team, for Dr. Krishna Ella, for Suchitra Ella, and of course the lakhs of Indians who have opted for Covaxin. That wait has finally ended as the World Health Organization's Technical Advisory Group has given an emergency use listing approval for Covaxin, the India-made COVID-19 vaccine. Now, this process has been going on for quite some time. The WHO started its investigation into the approvals only in July this year, but the first attempt was made in April. They were waiting for phase 3 trial data coming in from Bharat Biotech. That finally came in June, and all of this time more and more documentation was asked for. In fact, the last meeting, which was hopefully the one where the approval would have come, ended with asking for even more documentation, which was finally submitted. So why is this significant? Why is this important? Three fronts broadly. Number one, those who have taken Covaxin can now be considered fully vaccinated by major nations of the world. Their individual approvals were pending, waiting for the World Health Organization to give its stamp. So if you've taken Covaxin, you are likely to be considered vaccinated by major countries. You will not have to go and be quarantined for 7 or 14 days as per those nations' laws and will be considered vaccinated. Secondly, Bharat Biotech will now be able to export Covaxin and be able to fulfill its commitments. India will be able to fulfill its commitments on a number of multi-nation forums like Gavi, which require India to give vaccinations and help to poorer nations or those who don't have access to the vaccine. The most important and significant factor, though, in my view, is that for a long time, and since its inception actually, Covaxin has been facing a number of questions and scrutiny from experts. There have been questions about whether the data is truly transparent. Where is the phase 3 trial data? Has it been seen? Is it got the efficacy which has been claimed? Do we know for sure that what the company says is true? In a sense, the World Health Organization's approval, after scrutinizing all of this data and after a very long process in which, as the WHO itself said, they didn't cut corners, puts some of those questions to rest, gives some relief to Bharat Biotech and Covaxin. The big challenge, though, for Covaxin still remains, honestly, to scale up its production. Even now, if you look at the proportions and the rate at which India is being vaccinated, almost 88 to 90% of all the vaccinations today administered in India are from Covishield and not from Covaxin. Covaxin is just about 10-11%. In a conversation with us, Dr. Krishna Ella explained that this is because its own platform and technology is different. It's an inactivated vaccine. So it takes the virus and puts in a dead virus and creates the vaccine. So it takes much more time just because of its process. But they do now need to scale up. Hopefully the WHO approval will help in that direction, and they will be able to provide this very crucial vaccine to more and more people.